find out how best to help you with your hearing problems. So are you ready to discuss these options?
Sure.
Okay. All right. So one thing I want to mention is this is a hearing loss management or treatment center. We are not necessarily just a hearing aids clinic. So I know when you came in, you're talking about hearing aids, but there are actually multiple options for you. This little tool,
Okay.
and this is a guide to help you decide what you want to do about your hearing problems. So the first thing I'm going to do is just give you a very brief outline of what some of these options are. After I tell you very briefly what they are, you can decide if you want to hear more about these in detail today, or if it's something that you think you might want to think about, but you really don't want to discuss in detail or move towards today. And in that case, I'll give you some materials, and you can go read them at home and consider if that's something you might be interested in the future. Okay? So, the first option is hearing aids. So based on your hearing test results and the problems we've talked about, I do think that hearing aids would be a really good option for you. If you are interested in using hearing aids, you do have to purchase them. Insurance very rarely will cover the cost of hearing aids. Also, you have to come in to have the hearing aids adjusted by an audiologist. Hearing aids aren't just one size fits all. So you have to actually practice using the hearing aids and really work together with the audiologist to get the hearing aids adjusted correctly for you. So you might have to come in several times for adjustments to get them just right. Now, you remember I said there are some options other than hearing aids for you to consider, and you are free to choose one of these other ones instead of getting hearing aids, and you can get a lot out of these other options. But for you, most of these additional options would be most effective if you use them in addition to hearing aids, in my opinion. So another option that I would strongly recommend for you is the hearing management group. So you remember how you told me that sometimes you don't ask people to repeat themselves because you don't want to be a bother, and how you and your husband both get really frustrated sometimes because of your hearing problems? There's a lot of really good evidence that these kinds of meetings with people who have similar hearing problems and get together and talk about better ways to cope with those problems can be really beneficial. And that's especially good for people who are new hearing aid users. So I really think that you and your husband would get a lot out of these meetings. This option, cochlear implant, actually based on your hearing test results, this is not an option for you. This is a surgical option that's for people with severe to profound hearing impairment, and your hearing loss is not quite bad enough to qualify you for this option. So this one's out.
Okay.
And then of course the last option is to get no treatment. So for this one, you would continue your daily life without making any changes. Okay? Alright, so what I want you to do is check off which of these options you want to know more about today, and we can discuss those in a little bit more detail. And then down here, if there's something that you're really not ready to talk about, but it might be something you want to think about, you can check these off, and I'll give you that kind of material to take home. Okay?
Okay.
And you can check as many of these as you want.
See. Can I talk while I do this?
Absolutely.
Okay. Fine, here you see now, that's something I want to know more about.
Okay?
Meeting with a group of people, I'm not interested in that.
Okay.
So just leave it blank, huh?
Right.
Using a DVD for training at home. That sounds interesting. Buying this too, buying one or more items at the community. I don't know what's available, so it would be nice to know about that. And being evaluated to see if an implant
This
might
one's
melt.
not an
That's
option.
not me, right? Continue my daily life, and that I'm not going to do.
Okay.
I want to make some changes.
Okay. Was there any that you don't really want to talk about, but you want to know more about, that can send some material home with you?
Well, this I would just want to know more about, and using the DVD I would want to know more about too.
Okay. So you want some material for that as well? Okay.
Yeah.
Do that. All right. So let's talk about these in a little more detail.
Okay.
Okay. So this first one, of course, is hearing aids. So let's talk about what's involved with the hearing aids, what is expected from you, and then the pros and the cons of each of these that you chose.
Okay.
Okay? So for hearing aids, you would be professionally fitted with hearing aids here. You would wear the hearing aids to help with your hearing problems. So what you would need, based on these options, do you have an idea about what you might want to do today? These are the options, and of course, you know.
Given these options, I want to pursue getting hearing aids.
Okay.
I think with me it's a really broad spectrum, you know, and I want to make sure that I can hear everything.
Mhm. Okay. What about anything else, the DVD? Is that something you're interested in, or you want to take some time and think about that?
I think it would be something that, even if you get hearing aids, I would think that could be helpful.
Yes. Yeah. Absolutely.
I might want to think about it some.
Yeah.
You know,
Okay.
but-
Yeah. No problem. And then the assisted listening devices, is that something you also would like to look at?
No, I don't think so.
Okay.
I think the hearing aid is what I'm really going to pursue.
Okay. That's great. So we can set you up to do the hearing aid evaluation and talk about what we think that you might need.
More fun.
Yes, and we can also tell you more about the training DVD if that's something that you would be interested in.
Good.
Okay. All right. Are you satisfied with what we've talked about today? Do you have any other questions?
I don't
or-
have any questions until I leave. Of course, then I'll say, wish I had asked this.
You can always call.
But, no, this was a good interview. I have an idea, you know, it gives me an idea of the results of my hearing test
Mhm.
and what it means to me and how I feel about it.
Good.
You know.